Hello and welcome to Cumberland Conversations. I'm Sally Shutt, Cumberland County's Public Information Director. This month's conversation focuses on mental health, specifically safety net services and crisis intervention. We will learn about the Community Mental Health Center at Cape Fear Valley, crisis intervention training for first responders, and plans for a crisis intervention center in our community. Our guests are Doug Webster, the Service Line Director for Behavioral Health and Sleep at Cape Fear Valley Health System, and Wayne Cannon, Cumberland County's Crisis Intervention Program Coordinator. Thank you both for being here today. We're going to start out by talking about the Community Mental Health Center at Cape Fear Valley, how it started, and what the community can find there.
Okay.
Doug, tell us about it.
Community Mental Health Center is sort of a new concept, community being the important part, that what we're trying to do is develop services that are directly reflective of the needs of our community. Part of that is children's services, part of that is adult services, part of that is crisis intervention services. And we're trying to develop a system of care that reaches people at whatever level they need and to be both cost effective and efficient in what we're doing.
Well, how did the center come about? Because it was, it kind of grew from the mental health center
Correct.
or clinic for Cumberland County.
Right. Over the last 6 or 8 months, what had happened with the mental health center is they had started losing some psychiatrists to different facilities around the county and out of town. As a result of them losing a lot of their staff, what we saw is a increase in patients showing up in the emergency room at Cape Fear Valley. Significant increases. And that became pretty much the point of entry for a lot of individuals needing help. Administration got together and said, we think that we're in the best position to impact this, and started having conversations with the county over a period of months, and ideas started developing. What can we do with this? How can we improve services of the county? And finally, I believe it was on June 24th, there was an agreement reached with the county, with Alliance, which is the behavioral health organization, and Cape Fear Valley from our behavioral health to develop a renewed community mental health center, and the emphasis being the community and meeting the needs of the community off-site and other than the emergency room, and to be, like I said, as efficient and as effective as we could to move the mental health services in Cumberland County forward.
Okay, well, tell us where it's located. And
well, currently we are still at the old building, which is 109 Bradford. And we are in the process of renovating the second floor of the Roxy building. Roxy is on Roxy Avenue down the road from Rayford. And we should have the architectural plans in hand by next week. We're already meeting with all the contractors, ordering the many things that it takes to renovate the second floor of the building. And we fully expect to be in there by no later than mid-December.
so tell me about the transition. Has it been a smooth transition?
It's been a good transition. There's no transition that is easy. And we walked into it knowing that it's a change. Staff have been very helpful, very cooperative, learning new systems. Think that, we have a system, they had a system, and I'd said before, it's sort of like Canada and the U.S. We do the same thing, but our languages are a little bit different. The way we go about things are a little bit differently. One of the things we were first challenged with is a lot of staff that had left the mental health center in the past, or the mental health clinic in the past, and so we have a gradual process of bringing on new staff, which are actually designed to build the special programs that we want to go with going forward. So like I said earlier, one of those are children's services. We want to and need to expand children's services in the community. Part of what we're trying to do is to make access to care easier. It's a lot easier, the Roxy building, to access by bus. It will allow us to open additional hours. Right now, the mental health clinic is basically 8 to 5 Monday through Friday. Our plans are to go up until 11 o'clock at night and 7 days a week as we go forward and as finances permit. Hopefully, at some point, going to a 24-hour service. And that's part of that is the crisis intervention part. Instead of going to the emergency room, go to the Crisis Intervention Center and you'll get seen much faster, and it'll just be much more convenient. And from a bigger perspective, it's much less expensive than an emergency room, which is about the most expensive level of care that you can receive.
Okay, well, how can people in our community access the care to the mental health center?
Right now, people can call up for appointments. Like I said, we are still building the staff, so we are limited right now, and every week we make bigger gains in terms of being able to increase our capacity. We have a walk-in clinic that will be growing with time as we bring on additional providers. But basically, it's a quick call to 3232-111. And talk to the person there, and they will tell you what's a good time to come in and what they can do and what they can't do right now. Patience needs to be had right now because it is an evolving service as we bring the staff on. Interviewing people this morning, I have people interviewing tomorrow. We want to get the right staff to do it the best way we can.
Okay. Well, you know, you mentioned that the center at 109 Bradford Avenue will be moving to Roxy Center once those renovations are complete. That's big and exciting. So tell us a little bit what that center will look like over at Roxy and the services that are going to be offered there, those expanded services.
Okay. The good thing is Roxy is on a major bus route, so that makes access a little bit easier. And it's about 1.5 blocks from the hospital, depending on which way you go. So it's all sort of concentric. We will have ultimately 4 different services at Roxy. We already operate 2 services at Roxy, one being what they call facility-based crisis, and the other one is what's called non-hospital-based detox. A lot of words. Basically, we do detox and crisis intervention in a more simple term. And that we're currently operating 8 beds. That will go back to 16 beds around December, give or take, around that time. That's what's already existing. We're expanding that. On the second floor, we are going to relocate the mental health center, and Roxy is sort of a Y-shaped building, so one of the Ys, if you will be the mental health clinic or the community mental health center. Community Mental Health Center will provide walk-in crisis intervention. It will provide medication reviews, medication refills. We have a number of consumers that get injections on every 2 weeks, 3 weeks, or 4 weeks, depending on what the medication they're getting. We can do that there. We're always going to be watching for health screening and any kind of health problems. It will be the point of entry for any individual that needs detox. Right now, what happens is if a person is looking for detox, they might go to the Bradford Center, the old mental health center, or they'd go to our emergency room. Both of those take time. With the new center, they can go right to the Roxy Center. They'll be seen right there, and that's what we do and we focus on. So there's no transport from here to there to the next place and wait to be seen. That's what we do. So we expect to cut some waits that may be 4 and 5 hours down to 30 minutes. And unless there's a mass influx of people, obviously. So we will be expanding our children's services. We are in the process of recruiting a number of child psychiatrists, some very well-known child psychiatrists if everything comes as we plan, and expanding services in the community that are both very current and forward-thinking. At the other side of the Y, if you will, on the second floor, is going to be the crisis intervention unit. And that is a 23-hour evaluation and observation unit. So a person comes in and they need a little bit more than just somebody to talk to, and they need time to maybe calm down and get through the crisis, or they may need another level of care which is a little bit higher. So we can have a person there for up to 23 hours where a doctor may see them and get them some medication, see if that works and helps them, or it may be a staging area for the person to go, say, to detox or to go to an inpatient unit or whatever services are in the community. One of the things that we did recently is we joined with Mobile Crisis. Mobile Crisis goes out into the community, and for some people that are having a difficult time, say they come into the crisis center, let the person go back home. We can send Mobile Crisis out and meet them in the home the next day to help them transition and get through the crisis. We're going to be doing a lot of that. where we are coordinating with other providers in the community to provide the most supportive atmosphere to keep people, one is out of the hospital. Nobody wants to go in the hospital, so we want to do everything we can do to prevent that from happening. And that ties into developing what we call the CIT unit, which is Crisis Intervention Training, which Wayne will be talking about in a little bit.
And Wayne, I know you must be excited about this whole project.
Yeah, Sally, we are very excited about the prospect of the crisis unit, which will be a receiving facility that will allow our CIT officers to escort consumers to the facility where they remain there for assessment, observation, and stabilization. So this is a tremendous advancement for us. This is something we've planned for since the spring of 2008 when we first convened our CIT committee before we held our first academy. We knew that this is a goal that we had to work toward.
And kind of fill us in a little bit about what crisis intervention means for those of us not familiar with that.
Sure. Crisis intervention team is a specialized unit of law enforcement and other first responders. And for us in Fayetteville, that includes the Sheriff's Office, the Police Department, and other small law enforcement entities. And now we are beginning to train firefighters and EMS as well. But the responsibility of a CIT officer is to respond to a crisis call involving mental illness, substance abuse, or a developmental disability. And the officer goes out for the purpose of stabilizing that individual if possible and diverting him or her into services rather than incarceration at the detention center, and also to keep them away from the emergency department if it's not really that level of acuity.
Okay, well, we're going to take a break for just a few moments, and we're going to come back and learn more about crisis intervention training and the new Crisis Intervention Center. We'll be back in just a moment. Welcome back. We're with Doug Webster and Wayne Cannon discussing mental health services and crisis intervention training. Wayne, you were telling us about crisis intervention training in Cumberland County. Mm-hmm. Tell me some of the success stories that you've seen in the last 4 years through that program.
Absolutely. Sally, we've had so many successes. I guess the first that comes to mind is the number of officers and first responders that have gone through the program and become certified. With our first academy, we started out with 23 officers. We've now certified a total of 402 law enforcement and first responders, so tremendous growth. The program's very popular. But I think the greatest marker of our success really is the quality of the work that our officers do every day. I have the good fortune of receiving CIT reports on every call that takes place in the county, and I follow up on those first thing when I come in the mornings. And virtually without exception, when I contact the person who was in crisis or their family, the first thing I hear is the officer was wonderful. Recently I had a story where the family told me the 2 previous times their son was in crisis, he continued to escalate and ultimately was arrested. This third time, a crisis intervention team officer responded, and he was able to de-escalate the situation. They said their son settled down, and this time he slept in his own bed at home. And by the next day, the family had contacted the treatment provider, and he had an appointment for that afternoon. And it's almost every day that I hear those kind of stories. So that's the real success, the officers that are out there every day doing this kind of work.
That's very rewarding, I know, and we're very excited that we're able to take it up to the next level with having a crisis intervention center. Mm-hmm. Tell me how the impact you expect that this will have.
Absolutely. Our officers already do a great job of de-escalating folks in the community when they can. They also utilize mobile crisis teams, which are mental health professionals, which are able to come out and respond on site. But in so many instances, the person needs to be at another level of care, and this allows the officer to directly transport and transfer that individual to that facility where they can remain for up to 23 hours for observation, assessment, and stabilization. So this really completes our program.
Okay. Well, Wayne, tell us about the need we have in our county for crisis intervention.
The need is tremendous. We have so many people that end up in the Cumberland County Detention Center who are mentally ill and who have committed rather minor misdemeanor crimes and or so-called nuisance crimes, and the officer in those cases may have had no other option but to take them to jail. We have so many people that end up in the emergency department that really could have been better served at a lower level of care, like a crisis unit. So I think the crisis facility will meet that need so that the officers will have that other option, and it will diminish the number of people going to the jail that don't need to be there or accessing the emergency department when it's unnecessary.
Doug, tell me about how your views about crisis intervention training as a.
I've been involved with the crisis intervention training in several states going back almost 20 years, and this year crisis intervention team training was recognized for Cumberland County as the top in the state. It's something that everybody is excited about. The police officers out in the field. Every level of provider is excited about this, and I think the families who have members that need our services feel like they're getting treated with respect and sensitivity, and now we're moving to the next stage. It's been like a planning for years to get to where we're going, and now we can actually see where we're going. And just a few more months and we're at a whole nother level. This is big city stuff in a smaller Fayetteville town, if you will. So we're doing something very special, or we're involved in doing something that's very special. So everybody is excited. Wayne and I were in a meeting yesterday, and everybody cannot contain themselves just waiting for this to happen. I'm surprised people aren't saying, Doug, can you open it tomorrow? Which we'd like to do. But it's such a good thing, and it's the right thing to do, and it gets people care when they need it. And just because they happen to have a mental illness, they should have the right to expedient treatment, just like anybody that has a cardiac problem. This week, Wayne and I met on Monday with Emergency Medical Services, and they have committed to join in with us, and they are going to train a lot of EMS personnel and their paramedics. That's another level that we've added that is phenomenal. I mean, that was probably the best thing that happened with Wayne and I this week in terms of getting them to say, yes, we're in. So that's just more people that have sensitivity, people that have a mental illness or have a crisis situation in their life, that more people will be trained to respond as effectively as possible for what we can do. So it's great for the community.
Wayne, tell me about the collaboration. We've heard of Emergency Medical Services. You're with the Sheriff's Office. I mean, this is a community-wide collaboration partnership.
Absolutely. We have so many partners. Of course, the Sheriff's Office, the Police Department, the hospital, Fayetteville Tech, the Fayetteville VA, and so many others that I'm sure I'm leaving out. But this truly was a grassroots movement in Cumberland County when all these entities came together and acknowledged the need. National Alliance on Mental Illness, Cumberland branch, was crucial to the foundation here. Just so many people came together because there was a community need and did what they had to do to bring this program about.
Well, the Crisis Intervention Center then will be opening. When do you think that will be?
December.
December.
That's our target date.
That's great. And then let's kind of go back to what we'll find over at the Community Mental Health Center. It'll have the Crisis Intervention. Kind of give us, summarize again what that Roxy Center will look like.
We will have counselors, therapists on site, initially 8 hours, eventually going to 16 hours a day, 7 days a week, where anybody that's in any kind of a crisis can come in and see somebody and talk to them. It's an access point where there are no restrictions. If people want the help, we're going to be there to help them. So that's the sort of the entry level. And we want to do that as efficiently and with the highest quality that we possibly can. From that point on, we can go into our crisis evaluation observation unit, which is what Wayne's been working with in the community and training. And from there, we can hopefully keep people from ending up in the hospital if we possibly can. We can do this faster, we can do it less expensively. It saves the community money, it saves consumers money, which everybody's about that, but we can do it better. So it's every service that is available right now in the mental health spectrum, all literally in a one building site. So it's a one-stop shop, if you will. Get everything you need, hopefully, right there.
Wayne, you've been working in mental health in Cumberland County for how many years now?
20 years.
20 years.
Yes.
So, you know, you can really kind of put this in perspective for us. And
Yeah, in my time in Cumberland County, which is I've had a wonderful career with the mental health center and now joining the sheriff's office, I have never seen this kind of coming together of so many entities within the county, the city, the private sector with a unified goal to make things happen as far as the Community Mental Health Center at Cape Fear.
Everybody wants the same thing and they want it to happen. The support is unlike anything I've ever experienced.
Yeah, and the crisis center, the level of support is phenomenal, and I've never seen this before, and I'm very glad to see it now.
this was some wonderful information, and I really appreciate both of you being here and sharing it with our community. Thank you for listening in on our conversation. If you have any questions about today's topic, please contact the Cumberland County Public Information Office at 910-437-1921. We hope you will join us for future Cumberland Conversations. You can learn more about what's happening in Cumberland County government by visiting our website or our Facebook page.